health experts are saying now's a good time to take stock of the situation, to get vaccinated. But there's a lot of confusion about that, and it can be harder in some provinces than others. Alberta announced last month that most people in the province will have to pay about $100 for a COVID-19 vaccine this fall. The Alberta Medical Association has called that move, quote, counterproductive. But let's take a look at all of this with Dr. Isaac Bogoch, who's an infectious diseases specialist based in Toronto. Hi, Dr. Bogoch. Welcome back.
Thank you, Heather. Great to be here.
As I mentioned, all the signs are there of what's to come and what we'll be talking about in the weeks and months to come for sure. But this morning, let's focus on COVID-19. And let's do that to start with some of the numbers and graphs and trend lines we're getting from the Public Health Agency of Canada. The first I want to bring up, Dr. Bogoch, is the one that shows the new incidence numbers. So let's look at that graph first of all. And you can see it's a bar graph, but just at the far right-hand edge, Dr. Bogoch, numbers starting to go up again. What are you seeing in terms of incidence?
Yeah, I mean, we are starting to see a greater burden of COVID in the community settings. It's not nearly as high as what it was, for example, in the dead of winter. But, you know, this is the time of year where COVID cases seems to start rising again. We saw the same trend over the last couple of years. And, you know, when we compare to the lowest point, that was March, April, there was, for every case that came in that was tested for COVID-19, about 1.5 to 2.5% of those were actually positive for COVID. Now that percentage of positive tests has risen to about 7%. Which just tells us that there's more COVID circulating in the community.
So if we look at the other graph, which the Public Health Agency of Canada has provided, it does look to the past, well, this year and the past 2 years. And this year is the lowest line on that graph. Again, the incidence is lower than the previous 2 years, but as we've been saying, you start to see that rise. How concerning at this point is it to you, Dr. Bogoch?
I just think it's important that people are aware that COVID is not gone. Of course, it's still around, and we're going to see more of it as we move through the fall and into the winter season. And then there is a pattern to it. It will decline just like it has in the last couple of years around the same time. But again, it's just important that people are aware that it's out there. You're going to start to hear more from public health leadership in the various provinces and territories about vaccine campaigns. And remember, you know, this is the vaccine that does a remarkable job in reducing severity of illness, like hospitalization and death, but it doesn't do the same, it doesn't have the same degree of protection, for example, against getting infected and preventing onward transmission that it did much, much, much earlier in the pandemic. And that's why the recommendations for the vaccine have changed over time. And that's why they're saying it's especially important for older Canadians to receive this vaccine, because those are individuals who are at greatest risk for severe infection. So people over the age of 65, but especially those over the age of 80, should be considering getting this vaccine when it becomes available in the next few weeks.
Do we know at this point, Dr. Bogoch, what variant is circulating in the fall of 2025 and whether the vaccine will cover that, will offer that degree of protection against severe illness?
Yeah, we do. Two quick points on this front. There's very good surveillance as to the changing variants. You know, they usually have a bunch of letters and numbers associated with them. And I know we talk about them frequently. And of course, nothing has changed in that they continue to change. The vaccine, what's really interesting is the vaccines that have been deployed in Canada, regardless of the variant circulating, every vaccine deployed in Canada, including very likely the upcoming one that will be deployed this fall, every one of those vaccines, they have all done a very good job in reducing the risk of severe manifestations of the virus. So preventing those at greatest risk for severe illness from hospitalization and from death. Now, is the vaccine perfect 100% of the time in 100% of people? Absolutely not. No vaccine is. But this is a very good vaccine for reducing severity of illness. Not as good as it once was for preventing infection and onward transmission. I think it's just important that people are aware of that. And that's why many of the policies towards the vaccine have changed over time.
So, Dr. Bogoch, we're talking a lot right now in a lot of ways based on what's happening in the United States with some of the changes in protocols, both at the federal level but also at the state level. I'm thinking about Florida and vaccine mandates. So there's some controversy over vaccination. There's some confusion over vaccination. Who pays for what? Who needs to get what? So at this point, as we wrap up today, with COVID season coming, even if it's far from where we were in the pandemic, who needs to get a shot, and what should we keep in mind now?
I think it's really important to stick with the Public Health Agency of Canada and actually the National Advisory Committee on Immunizations, NACI. They're very sane, very smart, very data-driven recommendations. There's kind of two categories. There should get the vaccine and may get the vaccine. And if we think about the should get the vaccine crowd, it's people over the age of 65, especially people over the age of 80, people who live in an institutionalized setting. So, for example, long-term care facilities and nursing homes. It's very important because we know those are frail individuals and COVID can be detrimental. It's people who have underlying health conditions like immunocompromised states or other health conditions that put them at greater risk for severe infections. In general, those are the people in the should category. We know those people are at greater risk for severe illness, and the COVID vaccine will help reduce the risk of severe illness in those folks. Everyone else is really in the may category, not should, it's may category. The vaccine is available and some people will choose to get it. Some people might choose not to. And if people are curious as to what they should be doing, it's a great idea to have a conversation with a healthcare provider to help navigate that.
Dr. Bogoch, thank you very much. I appreciate it so much, as always, your visit on this Tuesday morning. Dr. Isaac Bogoch in Toronto.